Welcome to this explainer. Today, we're diving into something everyone here in the UAE knows a little too well, the absolute reality of maintaining your physical health during the summer. I'm going to be sharing some direct clinical insights from the incredibly dedicated team at Westminster Multispecialty Clinic, located right in Dubai Healthcare City. You know, at Westminster Multispecialty Clinic, what we see with our patients day in and day out is that navigating physical activity from June onward takes a whole lot more than just drinking a bit of extra water. It really requires a fundamental understanding of how extreme environments completely change human physiology. So let's just get right into it.
There's a saying around here that hits the nail on the head. Summer here is not just hot, it is heavy. And wow, if you're an active person in Dubai, you literally feel this in your bones. Anyone who's ever walked out of the nice, cool AC of their apartment and felt like they just stepped into a humid oven knows exactly what I'm talking about. We want to validate that experience right out of the gate. The combination of intense heat and that dense, suffocating humidity, it physically weighs on you. It's not in your head, and it's definitely not just a matter of being a little uncomfortable. It's a profound, measurable environmental stressor that fundamentally alters how your muscles and joints are operating.
So, here is our clinical roadmap for this explainer. We'll start with the heavy Dubai summer, look at muscle and tissue impact, dive into joints, weather, and recovery, cover some practical adjustments that actually work, and finally, discuss exactly when it's time to seek out physiotherapy.
All right, Section 1, the heavy Dubai summer, and why it is so much more than just discomfort.
Listen, we really need to shift our mindset away from just feeling hot and start looking at the cumulative effect. Commuting in the heat plus training later equals a massively elevated environmental stress level. Our team's approach to this at Westminster Multispecialty Clinic is to look at the total load on your body. You might be sitting there thinking, well, I train indoors in the AC, so the summer doesn't really affect my workouts. But actually, if you spent time walking to the metro, waiting outside for a ride, or just running errands in the midday heat, that compounding daily exposure is deeply affecting your baseline hydration and your muscular readiness. Basically, by the time you actually start your workout, your body is already exhausted from just fighting the environment all day.
Moving right along to Section 2, Muscle and Tissue Impact. We're going to talk about blood flow and biomechanics.
Here's where we get to look under the hood at the specific physiological changes we regularly see in our patients. We kind of have to separate the effects of heat versus humidity because they do different things. First, heat. When temperatures skyrocket, your body prioritizes keeping you alive over keeping your muscles fueled. It immediately diverts blood away from your muscles and directly to your skin for cooling. So what does that actually mean for you? It means your body is literally starving your working muscles of oxygen-rich blood, causing them to fatigue incredibly fast. It's like cutting off the fuel line. But then you factor in the humidity. Humidity is the sneaky one because it prevents your sweat from evaporating. And since evaporation is your body's #1 cooling mechanism, a high humidity environment means that mechanism totally fails. Your core temperature stays dangerously elevated. In this state, your connective tissues, we're talking tendons and ligaments, actually become overly pliable. Now, I know it sounds like being extra flexible would be a good thing, right? But it actually ruins your structural stability, making you super prone to sprains and minor tears.
And it gets worse when you look at what happens as you continuously sweat without actually cooling down. You weren't just losing water, you're quite literally bleeding out crucial electrolytes, sodium, potassium, magnesium, right through your pores. Because of this, your muscles lose their chemical ability to contract and relax normally. They just become irritable. And this directly leads to those sharp cramps, sudden spasms, and that familiar, awful feeling of having heavy, unresponsive legs. These are the exact things our physiotherapy team treats daily during the summer months.
Okay, Section 3, Joints, Weather, and Recovery. The invisible forces at play.
This part is absolutely crucial for our patients who are dealing with existing chronic conditions, especially things like joint stiffness or osteoarthritis. You've probably heard older folks say they can feel the weather in their bones, right? Well, they aren't imagining it. It all comes down to barometric pressure. This is the atmospheric pressure that shifts violently with humidity, and it physically alters the pressure within your joint spaces. Think of an inflamed joint like a balloon. When the pressure outside the balloon drops, the balloon expands. So for joints that are already inflamed or sensitive, these weather changes literally amplify the swelling and tenderness. It's a very real, very anatomical response.
But hey, the weather doesn't just clock out when you go to sleep. The reality is incredibly simple. Disrupted sleep equals disrupted soft tissue repair. One of the least talked about yet honestly most significant effects of sustained heat is poor sleep quality. Even if you've got the AC blasting, your body still struggles to achieve optimal deep sleep in the hotter months. And sleep is the exact time your body brings in the repair crew to clear out the minor exercise-induced inflammation from your workouts. When your sleep is disrupted, that minor muscle damage clears out so much more slowly. So if you're ever wondering why you feel perpetually fatigued in August, even when your workout routine hasn't changed at all, well, this is why.
Let's move to Section 4, practical adjustments that work. How we actually manage these compounding effects.
It's time to talk patient empowerment. What can you actually do about all this? Let's walk through 4 non-negotiable summer adjustments we give our patients at Westminster Multispecialty Clinic. Step 1. Train earlier in the day. Your core temperature is naturally lower in the morning, which means you have a much larger buffer before you start to overheat. Step 2. Increase your rest between sessions. Your body simply needs more time to clear inflammation right now than it does in December. Give yourself that grace. Step 3. Hydrate constantly, and I mean all day, not just during your workout. Remember that compounding commute stress we talked about earlier? You have to account for that. And step 4, prioritize a cold bedroom. Keep it cooler than you even think is necessary to really facilitate that critical soft tissue repair. Basically, your training load might stay the same, but your recovery environment absolutely has to evolve.
Finally, Section 5, when to seek physiotherapy. Knowing your clinical thresholds.
Because let's be real, sometimes, despite making all the right adjustments and doing everything perfectly, your body just reaches a limit, and professional medical intervention is required. I want you to genuinely ask yourself, when does typical summer fatigue cross the line into needing professional physiotherapy? It's vital to be objective here and evaluate your lingering aches and pains rather than just brushing them off as, oh, I'm just tired from the summer.
You really need to compare normal fatigue against the clinical red flags. Normal fatigue goes away with rest and hydration, and usually just feels like general, mild aches. But what about the red flags? Are you getting muscle cramps while you're just sitting on the couch completely at rest? Do you have joint swelling that's sticking around for more than 2 days? Are you experiencing recurring strains in the exact same muscle? Or is your pain actually getting progressively worse as the summer drags on? Look, if you're nodding along to any of these, it's a giant flashing signal that it's time to visit our chronic pain or joint stiffness rehabilitation experts.
Hitting that clinical threshold isn't a failure by any means. It's just a sign that you need some targeted backup. At Westminster Multispecialty Clinic in Dubai Healthcare City, our experienced physiotherapy team is fully equipped to provide expert assessment for exactly these kinds of unresolved seasonal and musculoskeletal symptoms. Whether it's chronic pain that's been slowly building over time, or a stubborn joint issue that's just getting completely flared up by the humidity, our team's approach is designed to actually resolve these compounding physical stressors. We don't just put a Band-Aid on them, we fix them. So, I'm going to leave you with this final provocative thought. Is your body flashing warning lights and giving you clear stress signals that you're just ignoring right now? The human body is incredibly communicative if we just listen. Paying attention to those signals early is exactly what makes the difference between needing a short, simple adjustment versus facing a prolonged, difficult recovery. Please, don't push through the red flags. Listen to what your body is telling you and reach out to Westminster Multispecialty Clinic to get it sorted properly. Thank you so much for joining me for this explainer. Stay cool, stay hydrated, and stay healthy out there.